efforts have been put in place to eradicate polio virus in the country, there have been few cases in the recent past. My name is Belden Waliaula, and this week we feature a man who rode a motorbike from Lagos, Nigeria to London just to create awareness about polio and vaccination. Besides that, we also talk about the role medical diagnostics play in our healthcare system. In 1988, the World Health Assembly adopted a resolution for worldwide eradication of polio. This marked the launch of the Global Polio Eradication Initiative, spearheaded by national governments, World Health Organization, Rotary International, U.S. Center for Disease Control and Prevention, or CDC, and UNICEF. Since then, world polio virus cases have decreased by over 99%, from an estimated 350,000 cases in more than 125 endemic countries then to 6 countries where polio cases were reported in 2021. This is according to WHO. Polio is a highly infectious disease caused by the polio virus. It attacks the nervous system and can cause total paralysis in a matter of hours. The virus is transmitted from person to person and spread mainly through fecal-oral route. However, it less frequently spreads through contaminated water or food and multiplies in the intestines. Initial symptoms are fever, fatigue, headache, vomiting, stiffness of the neck, and pain in the limbs. Polio mainly affects children under 5 years of age. However, anyone of any age who is unvaccinated can contract the disease. While there is no cure for polio, this deadly condition can only be prevented through the polio vaccine. This vaccine is administered multiple times to protect a child for life. Even with the different strategies and efforts in place to eradicate this disease here in Kenya, we still have pockets of outbreaks of the virus in various parts of the country. Other countries, some which neighbor Kenya, have reported worse cases. But one man has taken the initiative to hasten the eradication of polio in the continent. His name is Kunle Adeanju. Through his initiative, Kunle has decided to wear his heart on his sleeves by taking the fight against polio on 2 wheels. The bike. He cycled from Nigeria all the way to London just to create awareness and scale up the uptake of the polio vaccine. But before he started championing polio eradication, this is his backstory that rests in a dark past.
You know, when I was in elementary school, my best friend that sat next to me in class had polio. All right, and it was a touching moment thing, right? Because when we were kids that time, you know, doing all those things that kids normally do, you know, like you go swimming, you go jumping, you go running, he couldn't do it. You know, he couldn't do it not because he didn't want to, but because he was limited by polio. So, you know, the friendship continued. And sadly in 2021, that's about 2-3 years ago, we lost him. You know, it was really a tough moment because we kept our friendship all through. And I know what this guy went through. He really suffered a lot, you know, because of the limitation polio brings into people's lives. So he suffered quite a lot. So when we lost him, and I was going to do a ride, and I just said to myself, why don't you use this ride to raise awareness, to raise funds to the dangers of polio, so that another child somewhere that I don't even know, that I may not meet, doesn't go through the kind of pain, you know, my friend went through. So that was actually has been my attraction to polio.
He says most polio patients live a life that doesn't define their dreams.
The death, I felt it was painful, right? But, you know, the critical part was, I felt the pain of what he felt. You know, if you look at we human beings, the way we are created, we have our mind and we have our body. You see, the mind envisions what we want to do. Then the body carries us to do those things that we envision in our mind. Now imagine you can envision things and you don't have the body, which is the vehicle, to carry you to do those things. It can be a painful experience, and that is what people who have polio, that's what they go through. Because You and I, we can move, we can walk. They can't do it freely the way they want to. A lot of time they need help. So oftentimes they live a painful life of, I wish I can do this, but they are limited by the dangers of polio.
Through his friend's experience, combined with his adventurous nature, he decided to ride a motorbike from Lagos, Nigeria to London, United Kingdom to raise polio awareness while enjoying a taste of different African nations. His doing being as important as the outcome, Kunle's journey is his home. However, it followed intense preparation physically, mentally, and emotionally.
Always traveling from London to Lagos almost on a monthly basis. And I said to myself, why don't you just buy a bike and ride from London to Lagos? So it went into my bucket list in 2019. Then I started planning for it. Then COVID came. I had to suspend my plan. Then when COVID was left, there was some herd immunity enough for people to continue their normal way of life. Then I dusted back my plan. It took me a year to build the plan. Then when I finished with the plan, I said, okay, yes, I knew what I was going to do, and I knew my plan will work, that I can do this. Then I said to myself, if I just hop on my bike and start riding all through, taking the fun to myself alone, that would be selfish. So the question is, can I use my skills, my gift, my talent? And as Rotarians, what do? We say to people, bring your skills, bring your gift, your talent. Use it to touch life, use it to benefit humanity, use it to solve some of those little problems in the world. And I said to myself, I can use this gift to actually touch lives. And I chose a cause that was so personal to me, which was polio. So that was actually how I took that right to support and to raise funds and awareness towards ending polio in the world.
He shares the most challenging part of his travel.
First of the Sahara was, I had sandstorm. I experienced sandstorm. And most time, I did a lot of reading, so I've said, okay, if you experience sandstorm, what do you need to do to survive? And most time when you read about sandstorm, people die because it's difficult to breathe. I checked the weather forecast. There was no forecast. There was nothing about sandstorm. Usually I do that before going through, because when you get to the Sahara, nobody helps you. You don't see people you are your help. If anything goes wrong, you are the last resort to yourself. Even before rescue can come, that person is already dead. So I usually make sure I check, all those kind of things. And I was there in the middle of Sahara. Then I started feeling, the strong wind of the sandstorm. I weighed 93 kilos, right? But, standing, the storm was lifting me up. You can imagine 93 kg. The storm was almost lifting me up. I had to quickly bring down my bike and, held on to my bike. So the weight of my bike and that of mine was able to keep us down. And the storm lasted over 40 minutes.
He used social media to document and share his experiences. This connected him to like-minded people in the different countries he visited. He even took part in vaccinating children along the way.
I go to meet the market women and I go to talk to them. Sometimes I join the Polio Plus volunteers to go on immunization in the field. And because of the ride, and a lot of people being aware of the ride, when I get into, oh no, I want Lionheart to be the one to, vaccinate my child. And that brought a lot of people out to come vaccinate their children.
He says his is a calling aimed at the world, not just his native Nigeria nor Africa.
For me, the awareness was so much more important to me even than the funds that were raised, because one thing that we faced was the issue of vaccine hesitancy. People who don't want to get the vaccine, who are still afraid of the vaccine for their children. And because we're able to raise this awareness, we're able to remove those incidences of vaccine hesitancy. You now have a higher level of acceptance of the vaccine. So for me, that's actually a very, very key moment of impact of the ride.
He urges African countries to continue with vaccination against polio to ensure that the continent and the world at large is polio-free.
As long as the polio exists in any part of the world, people travel they can carry the virus in. So even if you vaccinate some children and you don't vaccinate others, they could be the unlucky ones to contact the virus that was brought in. So we have to make sure that vaccination, we continue to do that, so that way, when Afghanistan, when Pakistan are able to kick polio out, and is declared, the world is declared polio free, then maybe then we can stop. But for now, until that happens, when the world is declared polio zero, we all still have to vaccinate. And that's when
2023 is a critical year for the eradication of polio virus type 1 and 2. Only 2 countries in the world remain endemic for the world polio virus. They are Afghanistan and Pakistan. Kenya is surrounded by nations facing conflict, including Somalia, parts of Ethiopia, and even South Sudan. Democratic Republic of Congo, which recently joined the East African community, is also facing instability in the east, where healthcare systems remain basic. This puts the nation at a risk of outbreaks of polio due to the influx of unvaccinated refugees. Though polio has no cure, routine vaccination among children below 5 years remains the only bet to eradicate the crippling polio virus. Belden Waliaula, KTN News. In our interview segment today, we talk about the role medical diagnostics play in our healthcare system. And with me, I have Dr. Alan Pamba from Roche, but I'll let him introduce himself in a better way.
So I'm Dr. Alan Pamba. I am the Executive Vice President responsible for Roche Diagnostics across Africa, based here in Nairobi, Kenya. Roche is one of the leading global pharmaceutical companies that has both pharmaceutical division as well as a diagnostics division.
Can you expound what we mean by medical diagnostics?
Medical diagnostics, broadly speaking, is the process by which you determine the disease or the problem that a patient has with a high level of precision, so that the intervention that therefore follows is also equally precise. Most people, when they think about diagnosis, will probably imagine what goes on in a laboratory. Recently, we had the COVID pandemic. Many of us had to get a test to be able to determine whether we have COVID or we don't. That is an example of diagnosis. But it spans the entire range from, testing a bodily sample through to imaging, X-rays, MRIs, and so on. Yeah.
And based on that, how are you doing as a country? Are we evolving? Are you catching up with the current technologies? Or how is Kenya performing when it comes to amateurs having right diagnostics?
Diagnostics are a long way from catching up with where we need to be. Health generally is a long way from catching up with where we need to be. So at the moment, we are talking about a universal health coverage ambition, which is fantastic because it's gaining traction. What I do see as a gap is how are we going to pay for it? And there are 2 challenges. The first challenge is we only allocate 3 to 5% of GDP in most African countries to health. With 3 to 5 GDP allocation to health, achieving universal health coverage is not realistic. This is the first challenge that we have. So we have to go back to 2001 when African governments in Abuja all committed to put in 15% of their GDP into health. We have to go back to that and address that. But what ministers of finance will tell you is that health ministries are generally inefficient and don't give us a good return on investment. So they will challenge that even with the 3 to 5% of the budget that we put in health, we're not utilizing that efficiently. So could we first of all build some efficiencies with current health systems, demonstrate that we can do things more efficiently, and then ask for more budget? I can see that debate happening. So this is the first framing. The second point, which is important specifically with diagnostics, is that, and this is not unique to Kenya or to Africa, diagnostics is generally a very neglected part of healthcare delivery. If you look at the entire health budget in any given nation in the world, majority will put less than 5% of the whole health budget in diagnostics. So the bulk of it will go to the end staff treating when a patient is already quite ill. Now, this is quite inefficient because we know that if you catch, for example, cervical cancer early, it's cheaper. We have tests that can test for cervical cancer causing viruses very early. You will catch it early, you can actually treat it.
Our budget allocation to health is still low, and now that we have donor funds dwindling, how do we improve or maximize on domestic financing?
So let's question how we deliver healthcare in the continent. Over 60 years, we've relied on systems that are heavily dependent on government outlets to deliver healthcare, with huge centralized budgets, sadly, often not efficiently deployed in running these outlets. I think we're reaching an inflection point when we need to reflect how do we deliver healthcare and what is the role of government in delivering healthcare. The next point that is of important consideration is universal health insurance. I always tell my friends, if I was ever a Minister of Health in any African country, and it's not an enviable job at all, the one thing that I would do, Bildin, is make sure that you and every other citizen of this country walks with your health insurance in your back pocket. Let's achieve universal health insurance. Let's leave no one behind.
As a country, we've been focusing on curative care. So how do we transition to preventive services?
Where I think we have got it wrong since independence until now is where we put our money. And again, balancing where you put your money correctly. If you look at some of the leading economies like the US and Europe, their human capital has a very high value. Why? Because any average person in the US is generally well educated, is generally healthy, and are connected to the rest of the world. Probably more, I'd say more so in Europe than the US, but still, those fundamentals play out. We don't have that in Africa. Why? Because we don't balance the investments that we put in human capital versus investments that we put in other areas. There are three key areas where you look at the GDP of a country and you say, this is a country investing in its people. Health, education, and agriculture. Any country that puts good budgets in these three areas, you keep your population healthy, you try and achieve universal education for everyone, and you make sure that there's food security in your country, I think you are long away on your way to becoming a leading global economy.
How do we leverage on private partnerships to ensure that we strengthen the availability of medical diagnostics in our hospitals? Because we had programs like MES, where in counties, the equipments are just collecting dust. So how do we improve on that?
So the approach that we use is more around moving from what historically may have been transactional relationships to more longer-term strategic partnerships. What do I mean by that? If you have a hospital, I could come and sell you a molecular system that costs so much, I've made a sale, I'm happy. It's good on my numbers, you've acquired an equipment, but does that equipment fit in your ecosystem? Have we thought through everything that goes with that equipment to make it survive the 7 years it's supposed to run and give you the service you need? Probably not. If our relationship is transactional, that becomes your headache, not mine. I've made a sale. If our relationship is strategic, I will care to understand where is your space, where you want to put this equipment. How many tests are you doing in a month? Is this the right size of equipment for you or not? And how are you going to keep this equipment running in terms of service for the 7 years that you need it?
And how do we capacity build our health workforce to ensure that it goes hand in hand with the current technology? Because you find in some hospitals we have an equipment breaking down, and then you'll have to wait for an engineer coming all the way to India to repair it, or because we have an equipment but we don't have a skilled workforce to operate it. So how do we capacity build and ensure that what we have in the country, the health workforce, can match the medical diagnostics that we have?
On health worker capacity shortage in Africa, again, is another big challenge to achieving universal health coverage, even in the space of disease diagnosis. People don't see what goes on behind the scenes in the lab. You see your doctor, you see everything in the front, in the hospital, in the wards, but there's a lot needed to give you the results in the ward or in that clinic to help you walk away with the right treatment. That shortage that you see on the front part of the health system, the clinics, the wards, plays into the back room in the labs as well. We do not have enough specialists or healthcare manpower to deliver the level of diagnostics that the continent needs today. We don't have that. I'll give you a quick example. Take the example of cancer, pathologists. Africa has one pathologist for every 1 million population. It's not enough. Imagine one person having to read pathology slides for whatever number of cancers you get in any 1 million population. They will never be able to do it. Yeah. So we don't have enough human capacity to deliver these services. Roche is, in terms of becoming a strategic partner to Africa, has invested in healthcare worker training. We have trained over 8,000 healthcare workers in our campus, scientific campus in Johannesburg.
From your end, how is Roche partnering with the Ministry of Health to improve the availability of medical diagnostics in the country?
Kenya has an opportunity to be a continent-wide leader in digital transformation, even in the health space, even in the diagnostic space. We have done it in the fintech space with M-Pesa. I am excited to see us do it in the diagnostic space as well.
And lastly, before we go, what's the future of Roche in Africa?
Well, I'm excited about the future for Africa, but also the future for Roche in Africa. We have a ambitious 10-year plan where we want to increase the number of tests that we supply into the continent tenfold over the next 10 years.
Thank you so much, Dr. Alan Pamba, for your insights. And to our viewers, that's where we end our show today. My name is Beldin Waliaula.
KTN News. Get the whole story.